The emergency department, how it works and what to expect. Hello and welcome to the emergency department. Have you registered with reception? If not, please do so. When will I be seen? This depends on two things: how busy we are today and the severity of your injury or illness. The emergency department is not run on a first-come, first-served basis. Our staff always see the sickest people first. We use something called triage to determine who needs to be seen most urgently. Soon after you arrive, you will be seen by a triage nurse. The triage nurse is trained to find out what is wrong with you and to assess how urgently you need to be seen by the rest of our team. They pick up on clues that might make your case more or less urgent than the other people waiting. The triage nurse will prioritise you based on your condition, but if anything changes or you begin to feel worse while you're here, please let us know right away. Why am I waiting? Our emergency department is connected to a much larger network of people and services right around the hospital and beyond. All these moving parts work to look after you, especially if your problem is complicated or urgent. There are a lot of places where care, tests and results may take time, and this can lead to waiting. Emergency departments are carefully staffed with more doctors and nurses when we know there will be more patients. But even so, if we have a lot of people needing care, we need to ask people to wait. You may take one family member or friend with you into the examination room. Why not the whole family? Well, along with concerns about space, we also need to protect the privacy and comfort of all patients. Sometimes just a curtain separates you and the next patient, and they may be seriously ill and need peace and quiet. Our patients' privacy is important. Please keep your mobile phone or camera in your pocket or bag. This is not a place to take selfies or videos. Clean hands save lives. By keeping your hands clean when you come in and while you're here, you can help protect us all from infection, including our most vulnerable patients. It's important that the emergency department is a safe place for all patients and healthcare staff. If you are aware of any loud or unwelcome behaviour, please let a member of staff know. The majority of people attending the emergency department can go home after having tests or treatment. However, about 2 in every 10 people need further tests or specialist care and will be admitted to stay. Sometimes, when a patient needs to be admitted to the hospital for specialist care, there is no bed available on a hospital ward at that time. When this happens, the patient will wait here until a bed becomes available. If this happens, our team will continue to care for you here in the emergency department until we can safely hand you over to the ward staff. We are sorry for any delays that might arise, and if you have any questions or need anything, please ask one of our team. Part of our job is to make sure we answer your questions and give you clear information while you're here. So before you go home, please take a moment to ask yourself, do I understand my condition and the treatment I've been given? Do I know my next steps or what to look out for? If I have a follow-up appointment, do I know the details? Written instructions are easier to remember, so we suggest you take notes. Thank you. We hope this has helped to explain how the emergency department works. Please talk to any member of our team if you have any questions.